Great. Thank you so much, Anna. Next slide, please. My name is Anna Doroghazi. I'm a Government Affairs Director with AARP. I am joined today by three colleagues from across AARP. We have Lauren Ryan, who's one of my colleagues in Government Affairs. We have Jackie Budilov, who is with the AARP Foundation. And we also have Olivia Dean with our Public Policy Institute. So today we're going to be talking about tackling SNAP access barriers for older adults. We're going to kick off with Olivia and go from there. Next slide, please. All right, so we're going to kick it off to Olivia and then move on to Jackie and Lauren. If you have any questions, we'll take them at the end. Go ahead and put them either in the chat or in the Q&A as we go, and we'll leave some time at the end of our presentation. Thanks.
All right, thanks, Anna. So I'm gonna get started with a little bit of background on food insecurity and SNAP among older adults from some of our research in the Public Policy Institute. Some of this is from our reports that we have published, and some is from upcoming reports that will be published in early 2025. So we know from the latest current population survey data that 1 in 10 adults 50 and older are food insecure. That was 12.6 million adults 50 and older in 2023. And food insecurity rose in 2022 and 2023 following years of decline, as you can see in this graph to the right. High food prices and the end of various COVID-era relief measures likely played a role in this. For example, the end of the emergency allotments, which were, these temporary pandemic-related payments that supplemented regular SNAP benefits, as well as other things like the start of Medicaid redeterminations again. And food insecurity is associated with poorer health outcomes among older adults, including diabetes, high blood pressure, congestive heart failure, asthma, and depression. Next slide, please. Oh, okay, there we go. So we also know that racial and ethnic and other disparities in food insecurity persist among older adults. As you can see from this chart, American Indian, Alaska Native, Hawaiian Pacific Islander, Black and Hispanic adults 50 and older have much higher prevalence of food insecurity compared to white and Asian adults 50 and older. We also see differences by other subgroups. For example, people who are low income, who are women, those who live alone, those living in rural areas, and those with low educational attainment also have higher food insecurity prevalence. Next slide, please. SNAP is a critical program for older adults at risk for food insecurity. I think everyone on this call is probably very aware of the SNAP program, but we just put out a fact sheet recently with the latest data from fiscal year 2022, showing that nearly 10 million SNAP households, nearly half of all SNAP households, had at least one adult 50 and older in fiscal year 2022, and that adults 60 and older make up a growing share of SNAP participants. We also found that most older SNAP participants live alone, and nearly half of participants ages 50 to 59 have a disability. We don't have that data for the 60 and older population, but we can probably assume it's similar or higher. SNAP households with adults 50 and older also received an average benefit of $185 per month in fiscal year 2022, or $321 when including emergency allotments. Next slide, please. So we know that SNAP improves food security and it's associated with better health outcomes among older adults. It's been linked to fewer hospital admissions and long-term care admissions, improved medication adherence, and lower healthcare costs among older adults, with one study finding that SNAP participation saved nearly $2,400 per person per year in Medicaid spending. Next slide, please. Our latest report also finds that SNAP lifts older adults out of poverty. Sorry, this For some reason, it's looking a little blurry on this when presenting right now, but essentially, we found that regular SNAP benefits lifted nearly 2 million households with adults 50 and older out of poverty in fiscal year 2022. And then that SNAP plus emergency allotments lifted nearly 3.5 million out of poverty. So it's hard to tell because this looks kind of blurry right now, but essentially that's equal to 18% lifted out of poverty due to the regular SNAP benefits and an additional 17% lifted out of poverty when you include emergency allotments. Next slide. However, we also know from our research with Mathematica that participation in SNAP among older adults is disproportionately low among or compared to younger age groups. We worked with Mathematica on some analysis that will be published early next year and found that using state-specific SNAP eligibility rules, 16 million adults 50 and older were eligible for but not enrolled in SNAP in fiscal year 2022, the majority of whom, 14 million, were 60 and older. And so this translates to 59% of eligible adults 50 and older who were not enrolled in SNAP in fiscal year 2022. So eligible adults ages 60 and older had particularly low levels of participation. An estimated 66% of that age group, of eligible adults in that age group, were not enrolled, compared to 33% of eligible adults 50 to 59. And we do have a earlier version of this analysis on our website using fiscal year 2018 data, but that really has pretty similar findings, and you can find it at that link on this slide. We'll be publishing this 2022 data very soon in early 2025. Next slide, please. So we dug into kind of some of the characteristics of those older adults 50 and older who are eligible for but not enrolled in SNAP, and we found they're less likely to live alone compared to participants. They're more likely to have higher incomes than participants, and that, but still overall low income. Over half would be eligible for the minimum SNAP benefit. So 55% would be eligible for the minimum SNAP benefit, which was $20 per month in 2022 for most states. However, nearly 4 million would be eligible for over $200 a month in benefits, including over 3 million eligible for $300 or more in benefits. Next slide, please. All right, so we wanted to know, we know older adults are disproportionately under-enrolled in SNAP. So what are some policy options that could potentially improve participation in the program? So we did some follow-up analysis with Mathematica to look at certain state policy options in particular that might be associated with SNAP participation. And we found that 3 in particular were associated with higher SNAP participation among adults 60 and older in particular. So one of those was broad-based categorical eligibility, BBCE, found that was associated with an 11 percentage point increase in SNAP participation among adults 60 and older, which I think many on this call are probably aware of these policy options, but essentially BBC allows states to raise income limits or raise or eliminate asset tests for SNAP. SSI CAP, the Supplemental Security Income Combined Application Project, was another one associated with a 7 percentage point increase in participation among adults 60 and older. This is a demonstration project that allows people to apply for SNAP and SSI at the same time through a combined application. And then extended certification periods was associated with a nearly 15 percentage point increase in SNAP participation. So this is extending the length of time participants can receive SNAP for before having to recertify for the program. And this is often a component of ESAPS, the Elderly Simplified Application Project, which is another demonstration project that aims at making it easier for older adults to apply to SNAP. And we actually looked at ESAP in this analysis, but we didn't find it was associated with higher participation among older adults. But ESAP can have, many different components, and it's implemented differently in different states. and the extended certification period part of many ESAPs was associated with higher participation. We also looked at SMD, the standard medical deduction, which is another demonstration project that implements a standard amount that households with elderly or disabled members can use to deduct for medical expenses. And we didn't find this was associated with higher SNAP participation either. But states may still want to pursue options like ESAP and SMD because they can still simplify application processes and reduce administrative burden, even if we didn't find they were associated with higher SNAP participation among older adults. Next slide, please. So some of the implications of this research, so SNAP outreach efforts should be targeted to those who are lowest income, many of whom are missing out on substantial SNAP benefits, as well as those ages 60 and older, who are disproportionately under-enrolled in the program. SNAP processes should be streamlined, SNAP benefits should be adequate, and expanding BBCE and SSI cap in more states could improve SNAP participation among adults 60 and older, as well as extending certification periods. Next slide. So that's it for me. I'm going to turn it over to my colleague, Jackie.
All right, thanks, Olivia. Hi, everyone. I am Jackie Budilov. I'm from AARP Foundation. We are a charitable arm of AARP. Our goal is to help older adults with low incomes access the benefits that they need to afford their essentials for health, including food, healthcare, and medicine. And so SNAP is a big focus of ours at the foundation. Next slide. Through some research that we did with the Social Policy Research Associates, we tried to map out the journey that older adults take when trying to learn about and access, utilize, and recertify in the SNAP program. And we laid out what are the different ways that somebody might access these programs and what are the barriers that they might face. Something that comes up again and again through our research, as well as a grant maker to organizations helping older adults apply for benefits, is that stigma is a barrier to older adults wanting to apply. That even if older adults know about the program, they might choose still not to enroll. So we decided to see if the foundation could do marketing to try to combat that stigma. Next slide. We often see behavior such as applying for a program as a choice. If I were to poll everyone on this call, you may know that in general, a carrot is healthier than a donut, but we often don't choose the carrot in every situation. If you think about eating healthy in terms of going to a restaurant and seeing what items are available there, who you're eating with and and what types of foods they decide to eat, the prices of foods, there's a lot of different factors that might influence our behavior, so that knowledge and awareness is only one component of it. Next slide. Knowing that knowledge is only one part of the picture, we decided to embark on a research and marketing campaign that uses behavioral science to try to overcome stigma and normalize the use of SNAP. In this slide, you can see that there are numerous factors that come into play, both with your knowledge, but then also environmental factors, social norms, so knowing what other people who are like you are doing or what they want to do, the perceived consequences of rewards, risks, or the penalties of not taking an action. And there's others here as well, but this is really to raise the point that just because we do SNAP outreach, just because we tell people that this program exists, it doesn't mean that people are likely to take action because of all of these other factors. Next slide. So in creating our research, we wanted to look at two different types of stigma. The first was self-stigma, and that is, how do people perceive themselves about using SNAP? The second was community stigma, which is, how do people feel about others using SNAP? And our research and our marketing campaign was set to address these two types of stigma. Next slide. So a quick overview, without getting too in the weeds, we did a decent amount of baseline research through qualitative interviews and then a quantitative survey. We did message testing. And through those research pieces, we were able to develop a stigma scale to look at the prevalence of stigma amongst our audience. We then ran a paid media campaign in Houston to be able to try to influence people's awareness, but then really their stigma and their beliefs around SNAP. And then we ran a post-campaign evaluation to see if our marketing campaign was able to overcome stigma, with the hope that we would see a decrease in self-stigma and increased likelihood that people would apply for the program. Next slide. All right, so in our baseline research, we looked at 1,500 older adults that completed a survey online. So I will caveat that these people had access to the internet. And we looked at who was enrolled in the program and who was not enrolled in SNAP, even though all of the people that were eligible to take our survey were likely eligible based off of their household income. And what we found was that the people who were not enrolled in SNAP were likely aware of the SNAP program. 85% of people who were not on SNAP were aware. So this kind of supports our hypothesis that just telling people that this program exists and that they might be eligible is not enough to get them to enroll in the program. Next slide. For the people who were not enrolled in SNAP, but were either eligible or likely eligible, we also found some interesting findings of why they did not think that they might be eligible for the program. Amongst those who were eligible but did not think that they were, more than a third thought that they needed to live with children. That the SNAP was only a program that was available to families, and especially families with children, and not for older adults. We saw this similarly amongst people who were likely eligible, but did not believe that they were eligible, that living with children was a big factor in them believing that they were not eligible for the program. Next slide. Through our survey, we looked at people who had low, moderate, and high levels of stigma. And we found that people who were not enrolled in SNAP were 44% more likely to have moderate to high self-stigma and 127% more likely to have moderate to high community stigma than those who were already enrolled in SNAP. So stigma is clearly a component or associated with this enrollment. Next slide. All right, so our research also looked at how we could address stigma through behavioral science using these behavioral determinants. And if you remember that slide earlier that had the icon of a person with all of the different factors influencing their behavior, this is what drove our research. We looked at several different determinants, such as self-standard, which is very common amongst older adults of thinking, I can get by. I've gone my whole life without needing assistance. I can get by on my own. We looked at reward, so the determinant of the perceived consequences of I can get something good if I take an action, like enrolling in SNAP. We looked at social norms. So this research took place in 2022 when food prices were still rising. And so we emphasized that get help with your groceries. We know that food costs are high. Get help with your groceries. There's a reward here. The food costs are rising is that social norm of saying there's an environmental factor here. It's okay for you to need SNAP because of things that are going on in the environment. And then our fifth determinant that we tested was a self-standard of getting what's mine. I've paid into the system. I paid my taxes. I've done my time. I deserve this because I'm eligible. Next slide. What we found was that all of these behavioral determinants actually did a pretty good job of making people feel more positively about SNAP. They also were shown to be highly relevant to people who saw these ads. And they all made them more likely to apply. I could have showed you this slide for all three of those things, but the graphs looked exactly the same. So you'd be feeling like I'm showing you the same image over and over again. We looked again at all of these determinants based off of people who had low self-stigma and high self-stigma. And we decided to look at food costs and help with groceries as the top performing ads to test during our marketing campaign. You might note that Deserve This actually performed pretty well. So people thinking like, I've deserved this, I paid into the system. But we thought that even though this made people think more positively about SNAP, we didn't want to unintentionally reinforce any misconceptions that because somebody might deserve this, there are other people that don't, and having more of a stigma message than we wanted to overcome. Next slide. All right, so using that information from our testing, we created these marketing materials. In the top left, you can see the gentleman with the grocery cart and the image next to it. This was created to go on social media, to be online. We have below that some direct mail that we mailed out to folks. And then on the side, we had out-of-home marketing where we put this marketing in grocery carts and grocery stores. We also put it in senior centers and tried to somewhat saturate the market so that people would see this message more than one time, both online and out of home. Next slide. Without being a researcher, I won't get into too many of these details, but what was really exciting to us to see was when we ran a follow-up survey after we did our marketing campaign, we found that exposure to these messages that were attempting to normalize SNAP and reduce stigma were able to decrease self-stigma and increase the likelihood of applying to SNAP. We did not see a decrease in community stigma, but these messages were able to reduce self-stigma amongst the audience. Next slide. So there are a couple of takeaways that I'm hoping can come out of this research. The first is that behavior change marketing may be helpful for shifting social norms and reducing the stigma around SNAP with the hopes of increasing program participation. We have been working with grantees for a long time to do outreach, and we are hopeful that this is a great way for people to talk about SNAP that can overcome stigma and not just increase awareness. The second takeaway is that outreach should tailor messages to address the misconceptions about eligibility requirements. And we often see kind of broad general audience marketing when it comes to SNAP, where one marketing material might go to everybody that an organization might see. And in doing so, this might be perpetuating misinformation. So if an older adult is going to get a marketing material about SNAP and see families with children on it, it might reinforce this misconception that you must have children in the home to be eligible. So there is a potential to tailor messages when you know your audience to help to reduce this misconception. And then the third takeaway is that we're hopeful that behavioral change science may help increase enrollment in other programs as well. I've seen a different research study that was able to use behavior change science to increase unemployment enrollment, but I think that there are other options with Medicaid and other benefits that can help decrease the enrollment gap as well. Next slide. All right, and with that, I'm going to turn it over to Lauren.
So we're just going to do a quick switch out of slides here.
Okay.
1 second. Sorry, I'm trying to share my screen.
And actually, Jack, while Olivia does that, there's a question in the Q&A. Is the AARP Foundation looking into different targeted marketing strategies to help reduce community stigma? And if so, what are those ideas?
Great question. So right now we are trying to get this information out to organizations like our grantees to help them be able to incorporate this into their own marketing. Beyond that, I'm actually open for suggestions of how you think this could be really helpful in your communities, how we could support you in getting this information through your organizations. So please reach out. I think our contact information will be here later at the end of the slides.
Can you all see my screen?
Yes.
Great. All right, go ahead,
All right.
Lauren.
All right, thanks. So hi, everyone. My name is Lauren Ryan. I'm a Government Affairs Director with AARP's Government Affairs team. I think while Jackie was speaking, I was thinking about how important it is that we know that older adults are under-enrolled in SNAP and trying to figure out, how do we address those behaviors and that stigma. But on the advocacy side, we also want to see how policy decisions and policy plans and options impact access and barriers to SNAP. And so I want to spend a little bit of time talking about those federal solutions and the federal policy options that can address things like barriers and access. So let's go to the next slide. So within our advocacy work, we really view the ways to improve access to nutrition assistance for seniors through the lens of 4 overarching policy objectives. The first is making sure that we protect access to programs like SNAP and other nutrition services for older adults, making sure that we're making sure that those eligibility is protected, as well as the benefits themselves are protected. We also want to make sure that we're reducing administrative barriers and red tape that can limit SNAP participation among eligible older adults. And so I think what we really want to do is make sure that those who are eligible are able to access benefits that they qualify for, and that if it's not just more than the behavior or the stigma that's impacting this, which obviously we also want to address, that those barriers are broken down. We also want to explore ways that we can enhance program benefits for participants. So either expanding benefits or improving the program and the individual nuances of how it works to make sure that it does work for those who use it and it's meeting people where they are. And then finally, strengthening other nutrition programs. So within the Farm Bill, we're also looking at things like the Commodity Supplemental Food Program, the Seniors Farmers Market Nutrition Program, and the Emergency Food Assistance Program. And while I think we wanted to focus this discussion on SNAP, I should also say that we pay pretty close attention to the Older Americans Act, which addresses senior nutrition through programs like home delivered and congregate meals. So there's a whole spectrum of ways that we can look at, the federal policy solutions and advocating for addressing those barriers and making sure people have access. So we'll go to the next slide. So as we look at ways to implement these objectives and policies, we are keeping a very close eye on the Farm Bill, which houses and authorizes SNAP. So I do want to give a quick update on where the Farm Bill reauthorization stands. The Farm Bill did expire in September of 2023, and it was extended for 1 year before expiring again in September of 2024. Programs like SNAP do continue to be operational despite the authorization having expired. But I will say that leaders in both chambers and both parties have indicated that they're focused on ways to really come to a reauthorization agreement. I think we just had an election last week, which I think will have some impact on where things head going forward. But as we sort of head into this lame duck session with that legislative session next year, there are multiple pathways for reauthorization. So two of the prevailing options are, a fully renegotiated 5-year Farm Bill that's reauthorized by the year end. That is still under consideration. It's, like I said, it's something that leaders in both parties, in both chambers, have indicated is their preference. It's something they'd really like to work towards, but they are still negotiating. And so there's questions of whether that might be feasible. In the chance that it's not, and they don't come to an agreement by the end of the year, there is some intel that suggests that they are also looking at an end of year Farm Bill extension with then for about a year, with then reauthorization deferred until 2025, where negotiations will continue. So I will go to the next slide to talk a little bit about what we're seeing in terms of the proposals within this Farm Bill as we explore some of those policy solutions to addressing senior hunger. So both the Senate and the House have released details of their plans, either via a framework or an actual bill language that they would like to see. I think both have indicated there's room for negotiation. But as a part of these negotiations, I think a number of issues have really risen to the top of the priority list. Some of the general priorities that we are hearing and that have been highlighted include things like addressing access, education and outreach, ensuring incentives for healthy eating, and then also addressing things like fraud and integrity within the SNAP program. One of the major points of contention right now seems to be how to address Thrifty Food Plan reevaluations. For those who may not be aware, the Thrifty Food Plan is the basis for which SNAP benefits, SNAP allotments are based. It sort of outlines the cost of feeding a family of 4 on a very conservative budget. And as I said, that is how SNAP benefits are sort of determined and calculated within the 2018 Farm Bill. The 2018 Farm Bill included a provision that would allow for the reevaluation of the Thrifty Food Plan about every 5 years, and it's something that's under consideration. I think there's budgetary concerns, and then there's also concerns around, what does that mean for benefits and access and things like that. So that is one point of contention that I think is continuing to be negotiated. It's something that I think both sides are talking about and figuring out how to move forward with reauthorization. But that being said, there are quite a few areas where we see potential cooperation. I think we're paying particular attention to a few areas where there's some agreement and there's some very close, some opportunities to accomplish things that I think the spectrum of members of Congress can agree on. Some of those, as I said, that we are paying pretty close attention to are codifying the Elderly Simplified Application Project and allowing for greater flexibility in verification. It would extend certification periods to 36 months for older adults. I know that's something Olivia mentioned. And as she outlined, this would really help enrollment rates by reducing things like bureaucracy and red tape. We're also looking at proposals to expand incentives for healthy foods by reauthorizing and expanding the GusNIP incentive program. This program funds projects and incentivizes the purchase of fresh, frozen, canned, and dried fruits and vegetables. We're also looking at, again, sort of this overarching umbrella of, how do we enhance the program or expand the program? Are there ways that we can explore allowing SNAP funds for prepared foods? That's one other area. And then also addressing Puerto Rico's block grant funding, either by increasing resources for their program or developing a pathway by which Puerto Rico can transition from their current nutrition assistance program funding to SNAP over the next 10 years. And then finally, we're also looking at, how do we strengthen those other nutrition programs that I was talking about, right? Are there ways that we can expand offerings or increase funding? Are there ways to allow deductions from Medicare benefits when determining CSFP eligibility? So those are all things that are currently being discussed. Like I said, the vast majority of these that I'm highlighting here are bipartisan and have interest among sort of, like I said, the range of of members and in both chambers. And so I think there's some real opportunity here for us to address our concerns around SNAP access and the adequacy of benefits, and figuring out, how do we support this population of older adults who really just need the support at the federal level. So that's sort of the high level that I have. I want to pass it off to Anna, who will talk a little bit about how we can sort of transition and sort of see the drop down into state policy.
Great. Thank you so much, Lauren. I'm Anna Doroghazi. I'm another Government Affairs Director on AARP's Government Affairs Health and Family team. I work with Lauren while she focuses on our federal anti-hunger and food security issues. I focus on state policy. So even though SNAP is a federal program, states have a lot of policy leeway for how they can adapt the program to best meet the needs of the folks who are living in their state. So flexibility on everything from, do they administer the program at the state level or the county level? How do they determine eligibility? And how do they implement special options for specific populations? So I'm going to focus on just a couple options that states have used. Olivia touched on this a little bit in reviewing her research. So let's jump in and see what the landscape looks like. So the policies that Olivia had mentioned earlier, broad-based categorical eligibility, SSI cap, and extended certification periods are three policies where research has indicated that we do see a boost and get higher SNAP participation rates amongst older adults in particular. Next slide. One of the most widely used state options is broad-based categorical eligibility, which, as Olivia had mentioned, is a good way to expand SNAP eligibility for people of all ages. But one of the most important things we think in looking at this is that it raises income limits for SNAP up to 200%, and also raises or totally eliminates asset limits. Without BBCE, the asset limit is around $3,000 for a household, unless you have a member who is 60 plus or disabled, in which case that asset limit goes up to $4,500. This is of particular interest for older adult populations because a 65-year-old retiree can expect to live another 20 plus years, but 80% of households with older adults are financially struggling or at risk of falling into economic insecurity as they age. So $4,500 in assets isn't really enough to get a low-income household through a 20-year retirement period. So when we're talking about older adult populations, BBCE in particular is something that's really valuable, in part because of the ability to extend or eliminate those asset limits. Next slide, please. So again, the key advantages here, yes, it does increase participation in the program, but also giving older adults and people of all ages the ability to retain modest retirement savings or rainy day savings can really help people, both meet their immediate nutritional needs while also retaining hope for a more secure and dignified future. Whether that's paying for repairs to a broken furnace or covering a medical bill or, recovering from an injury without completely depleting their savings. Moving forward, we need to keep an eye on the federal landscape to make sure that we don't place new limits on BBCE, but we also have an opportunity to expand it to the 9 remaining states that don't have it, and to fully eliminate asset limits in 4 states that utilize BBCE, but maintain some limits on assets. Next slide. The next state policy option that Olivia and Mathematica's research found to be associated with higher older adult SNAP participation is the SSI cap. So just in the interest of time here, you go ahead and move to the next slide. There are 10 states that have modified caps and 7 states that have what we would consider traditional caps. But some of the key advantages here are the simplified application process, the extended certification periods, and the decreased administrative burdens that applicants face. Next up, Olivia mentioned that in her research, there wasn't as much boost to overall SNAP participation when you look at the Elderly Simplified Application Project. This is a relatively popular option. 22 states plus DC currently participate in this project. Next slide. But again, as we've seen with some of the other state policy options that we've discussed, one of the options that states have within this ESAP package is that they have the ability to extend certification periods to up to 36 months. And that was one of the pieces where we saw some of the strongest increase in participation for older adults. Next slide. And one of the new policy trends that we're seeing across states is to increase state minimum monthly benefits. So far, 3 states have enacted state minimum monthly benefits. DC had a program that was in place this year that just expired in September, but we're starting to see, since New Jersey first took this approach in 2023, a lot more states are interested in doing this. So currently, we know that every dollar that a state household receives in SNAP benefits is helpful, but the minimum monthly benefit for a 1 or 2 person household is currently $23 for the lower 48 states. And some folks have pointed to this low minimum monthly benefit as a barrier to going through the process to apply for SNAP benefits. So coming off of some of those COVID emergency allotments where we saw SNAP benefit levels increase, New Jersey was the first state to take this approach to guarantee a statewide minimum benefit in 2023, setting their state minimum benefit amount at $95 a month. New Mexico and Maryland have now also increased those benefits to $100 a month for New Mexico and $50 a month in Maryland for households that have at least one member that's 62 plus. And in addition to encouraging more older adult households to participate in SNAP, this approach has the added advantage of improving health and buying power for participants within the program. Next slide. And actually, we'll just go to the end here. We have not a lot of time left, but if you do want to learn more about the research that Olivia's done, the work of AARP Foundation, and some of the resources that serve as the basis of AARP's federal and state SNAP and food security advocacy, there are a couple links right here. I don't know. Who's the third state besides DC and New Jersey? Let's see, Maryland also, and New Mexico. I think that's the program that the minimum monthly benefits. I just saw a question in the chat there. So with 10 seconds to go, I don't think we can take any questions, but thank you so much to everyone who came today and was part of this presentation.